Hello everybody and welcome back to the Mind Ops YouTube page. My name is Shane Lemaster. I want to start off by thanking everybody who's watching our videos and liking and sharing them and subscribing to the channel. We appreciate that. We're here to put out these messages and put out this information in the hopes that you all find it useful and that you find some use in sharing it with your own friends, family, and communities so that we can all strive to be better human beings. So today we're going to be talking about a topic called co-occurring disorders. There's a couple other names for it. It can also be called dual diagnosis, comorbidity, but they all pretty much have the same meaning. And a co-occurring disorder is when someone suffers from an addiction issue as well as a mental health issue. Now, there's just like physical illnesses, most mental illnesses and addictions fall along the spectrum, right? So on one end of the spectrum, you can have a low-end mental health issue, say, on the low end of depression. We all have depressing thoughts from time to time, or a depressing day, or a depressing week. So that might be on the low end. Whereas on the high end of the depression spectrum, clinical diagnosis of depression may look like someone suffering from depression for long periods of time, maybe many months or years. So all these mental health issues that we deal with all fall on the spectrum, and everybody falls on the spectrum differently. Same thing with addiction. There's mild addictions, and then there's severe dependency issues. Again, on both sides of the spectrum. So when we talk about comorbidity, it's important that we discuss this issue because there's very real changes that need to be made to somebody's treatment if they're suffering from these comorbid issues. Okay, so for instance, comorbid issues for most people who suffer with addiction, about 98% of people who suffer with addiction suffer with some other form of a mental health issue. Again, it could be mild, it could be severe, but it does exist together in unison. And for most people, in my experience, it happens that the mental health issue occurred first in their life, and then later in life developed an addiction issue, partially because of the mental health issue, right? So maybe you develop some depression or some PTSD from trauma and abuse, or maybe some neglect as a kid, and then later on it turns into a drug use issue as we try and find coping mechanisms to drown out some of those unwanted feelings that come with trauma and abuse and anxiety and depression. Unfortunately, we happen to find a substance that works for that also does damage to us. It's completely natural for us as human beings to seek solutions and to seek ways to avoid or overcome pain. Now that's physical pain, emotional pain, any sort of hurt that we feel to our ego or our character. We seek to avoid these things or to remedy the pain when we feel it. So it's only natural for some of us to reach for illicit substances or alcohol or tobacco in order to feel something different, okay? The only problem with this is that these substances that we choose and the way that we choose to cope with these things is unhealthy, okay? So when we're talking about co-occurring disorders, I put a little diagram on my whiteboard over here that I'm going to share with you, okay? So this is what's called the Iceberg Profile. I don't know if any of you guys have ever seen this before, but my artistic rendition of an iceberg, please don't judge, I'm not an artist. But this blue area right here is the iceberg. And when we see an iceberg in nature, we usually only see this top part right here. It's only the surface level stuff. But what we know from icebergs in nature is that underneath the surface, deep underwater, is a much, much larger piece of ice with much greater mass. And this iceberg profile can help us sort of describe co-occurring issues in this way. So up here at the top is addiction, right? So this is the ice that we see on the surface. These are the behaviors and communication styles that we see from people suffering from addiction. Things like cravings, drug seeking, lying, cheating, stealing, drug use behaviors. Okay, those are all surface level issues that we see on the surface. But what a lot of the people around us, if we're suffering with addictions, a lot of people around us don't see all these underlying mental health or brain issues. Okay, and as you can tell from the iceberg profile, the mass is so much bigger underneath the water. So it would make sense that we would need to tackle these larger issues if we're going to overcome the addiction. Okay, the arrows, the green arrows on both sides, represent the cyclical nature that this can almost follow. So maybe we start with depression, which can lead to addiction, like I mentioned before. But because we find ourselves in addiction, low self-esteem comes along with that and only helps to fuel the depression. So it sort of goes in a cycle, goes to addiction, fuels depression, which fuels more addiction, which fuels more depression. And this can go for any one of these mental health issues. For a lot of us, we have aspects along the spectrum of a lot of these different things. So it's just important to recognize that substance abuse and mental health issues sort of play off of each other in this way to strengthen their relationship and keep us kind of stuck. Okay? So another cool thing about this iceberg profile that I think it helps illuminate is it helps us illuminate a little bit of what the treatment process should look like. Now, unfortunately, I've been through a number of treatment centers as an inpatient myself, and I've also worked at a number of treatment centers for both mental health and addiction. And it's an unfortunate state of the field right now that a lot of these treatment centers for addiction only treat the addiction. So they only treat these surface level issues. Now imagine this. Someone gets treated for their addiction, the addiction goes away, but they haven't addressed any of these underlying issues that may have caused the addiction in the first place or helped to facilitate it long term. So they go back out, they get released back into the community after their stint in treatment, and then these treatment centers wonder why the relapse rates are upwards of 90%. It's because the people who go to these treatment centers are not necessarily digging deep and resolving the underlying issues, the underlying mental health issues. Okay? So this iceberg profile kind of shows us what could be done if done properly, and when seeking treatment for co-occurring disorders, you need to make sure that you pick a treatment center that addresses both the addiction and the mental health. So it needs to be an integrated form of care, okay? So down here, in this corner right here, I've depicted a little chunk of ice, okay? And I've labeled it anxiety. This could be any one of these mental health issues in here. So the goal of treatment is not necessarily to tackle all these at once, okay? That can be too overwhelming for someone just in the initial stages of change. So we want to take it one issue at a time. So we're going to focus on anxiety here. Maybe the client has come in, maybe you've identified that anxiety is a huge part of your addiction and continues to fuel it, continues to give you cravings and triggers and really unhelpful thoughts around your anxiety that want you to resolve the anxiety in some way and escape through drug use. Okay, so we've identified that anxiety is a big factor in our addiction. So once we've identified it, we can kind of break that chunk of ice off of this big mass underneath. And because it's broken off, we can allow it to float to the surface. Now that's important because if these mental health issues stay buried, hundreds of feet under the surface of the water, it's very difficult to work with them. It's difficult to see them, okay? So first, in order to work with them, we need to bring them up to the surface, and a lot of people in therapy find this very challenging, but it's an essential part of the healing process. So we need to break this issue off, bring it to the surface. Now we can start to work with it a little bit better. Now we can start to see the surface level behaviors of anxiety, and we can employ coping mechanisms, right, to help manage those surface level issues. But coping isn't enough. Coping won't cure the anxiety. And so in the process of learning coping skills and gaining strength in our coping skills, we also need to start digging a little bit deeper into this little chunk. So again, the chunk floats to the surface. It's not all above the water, so we need to dig a little deeper. So what's under most anxiety once we dig a little deeper and ask ourselves those questions? Well, most of the time it's fears. Fears around the future, fears around the way people are going to think of us. These are the things that tend to cause our anxiety. So in order to overcome anxiety altogether, we need to find resolution for these fears, okay? And that can be a wide range of treatment modalities. But the point is, once we can start resolving these smaller chunks and these small chunks kind of melt away, we'll take a chunk here and a chunk here and a chunk here and a chunk here. And eventually, this mass of ice underneath the water will be so insignificant, will be so small once we've dealt with these issues, that the addiction has nothing left to float on and will just kind of sink or fade away. Okay, so that's the iceberg profile. A really nice way to explain this. Okay, we can also use the iceberg profile to work with individual emotions or individual mental health issues, right? So in this instance, anger, we all know the surface level anger behaviors, yelling, screaming, acts of violence, things like that. And we can use coping mechanisms to reel those in, arousal regulation skills, behavior management, mantras, things like that. But that's not going to cure the anger. What's going to cure the anger is if we go a little bit deeper and we find that our anger most of the time comes from a sense of feeling hurt. Either physically hurt, emotionally hurt, our pride is hurt, our ego is hurt, our character is hurt. Something about us has just been hurt, and instead of expressing it the way we should express it by saying to the person, what you said or what you did just really hurt me, instead of doing that, because we're not necessarily emotionally intelligent in the moment, we resort to anger. And we express this hurt by lashing out at others. Okay? So with depression, the same thing. Surface level issues that we might see above the surface, lethargy, isolation, just being quiet, not showing up for things on time, all sorts of things come with depression, sleeping more. And we can deal with those, we can put a Band-Aid on those and help cope with the depressive symptoms, but again, it doesn't cure depression. So again, we need to go deeper, go under the surface, and what do we usually find under depression? Well, most of the time we find some pain that needs to be resolved. And it might be from trauma, it might be from something else, but we find some sort of pain that needs to be resolved in order for that depression to go away. Okay? So one last important thing I want to mention is that it's my belief that there's nothing outside of ourselves that's going to come to the rescue and magically heal us from anything, whether it's a physical ailment or a mental health issue. There's nothing outside of ourselves that's going to swoop in magically and save us. Our healing needs to come from within. All of our healing comes from within. And if you think about it, how does the physical body heal? From the inside out. If you break your arm and you have a compound fracture and your bone's sticking out of your arm, what do? You go to the hospital. And what are they going to do there? The doctor's going to reset the bone, it's going to clean the wound, it's going to put a Band-Aid on it, right? That in itself doesn't heal anything. What the doctor is essentially doing is he is making the environment, your body, he's making the environment ready for your body to heal, right? So he's cleaning out all the nasty bacteria, he's setting the stage for healing to occur. And that's really the core of Western medical treatments. They're not curing anything. They're just setting the stage for your body to cure itself, which is a really cool concept if you think about it. So just like the body heals from the inside, so does our mind. Our mental issues need to be healed from the inside. Okay? Nobody's going to heal it for us. No therapist is going to give you the magic pill that's going to cure you. Okay? They're going to lead you in the direction of self-discovery so that you can find the answers yourself and heal from the inside. So one more little diagram, because I love my diagrams, to explain this healing from the inside process. Okay? So if you get a cut on your arm, right, you get a laceration, this is sort of what the cut looks like from a side view. Okay? So jagged edges, you got a cut inside. Okay? So we can always put a Band-Aid on the issue, right? But if you put a Band-Aid on this laceration and there's a whole bunch of bacteria and dirt and nasty stuff in there, what's going to happen? Well, the wound is going to get infected and the wound's going to get even worse and even more painful, right? So we can't just put a Band-Aid on the issue. We first have to clean it out. Same with our mental health stuff. If you think of this wound instead of a physical wound, now think of it as an emotional wound, a mental wound, some kind of trauma that happened to you, something that's unhealed within your psyche. Okay, we can put a Band-Aid on that. But if we don't first clear out all the nasty junk and the baggage and all the stories, all the negative stories that we're telling ourselves around what we're suffering with, that wound is just going to get infected. It's going to continue to fester and get worse, right? So first we've got to clean that stuff out by bringing these things to the surface and dealing with them effectively. And then we can start to heal. And the body and the mind both heal from its deepest point and heal outwards. Okay? A wound fills itself in from the inside out after, of course, the body puts its nice little scab protection or its natural band-aid over it. So these band-aids only prevent more nastiness from getting in, more bacteria, more negativity from getting in, okay? It doesn't heal anything. The body heals from the inside out, but we first got to clean out that wound. Okay, this is a depiction of just some pills, some medication, okay? And just like the Band-Aid, the physical Band-Aid on the physical wound, medications that we're on don't cure anything either, okay? So an antidepressant isn't going to cure your depression, okay? It's just going to mask the symptoms. It's going to bring your symptoms back to a stable ground so that you can start working with this underlying stuff under your depression, okay? Any sort of medication-assisted therapy that you're on for addiction is not curing addiction, but rather it's stabilizing the chemicals in your brain and reducing cravings and triggers so that you can start digging deeper into these underlying issues, which is part of the reason why the research in this area is very clear that any sort of medication-assisted treatment for mental health issues or for addiction shows much, much greater results if coupled with psychotherapy or counseling or some sort of therapeutic process. Okay, so medication alone can prevent people from relapse into mental health issues or relapse into addiction, but it's not going to cure any mental health issue and it's not going to cure any addiction. It's only going to set the stage for you to go deeper and to heal from the inside out. Okay? So that's co-occurring issues, co-occurring disorders, or comorbid disorders. I just want to emphasize to everybody and remind you that we're very thankful that you watch our videos. Please like and share our stuff. Please comment on anything. I will be going into much greater depth on some of these concepts that we talked about today in their own individual videos. But for now, I just wanted to give you an overview as far as what are co-occurring disorders, how are they most effectively treated, how are they ineffectively treated, unfortunately, in our field a little bit. There's some mistreatment going on. And what is the core of healing mental health and addiction issues? It all comes from inside, okay? Just remember, when we use drugs, we only really use drugs for one or two reasons: to feel something, or to not feel something, okay? And the point we're emphasizing here is we just need to be here. We just need to be now, and we need to feel what we're feeling and be okay with that. Learn to be comfortable with what you're feeling in the moment and stop trying to escape it. The more you escape it, the further away from the issue you get, okay? And in order to heal this issue, we need to go into it. We need to go deep into it, to the places that scare us, if we're going to come out on top being fearless, okay? So here's to your future fearlessness. See you next time. Please continue to like and share our videos, and thanks for watching.